This episode of DETV's Every Woman is brought to you by Delaware Health Equity Coalition, restoring trust in healthcare.
Every Woman. I'm your host, Catrice Thomas. I'm a psychiatric mental health nurse practitioner. Today, we're diving into a deeply important and timely topic, breaking the silence, opening up about mental health, as September is National Suicide Prevention Month, and just the other day, on the 10th, was World Suicide Prevention Day. It's crucial that we have open, honest conversations about mental health, a subject that affects all of us, particularly women. Before we begin, we'd like to issue a trigger warning. Today's episode of Every Woman will include discussions on suicide, mental health struggles, and related sensitive topics. If you or someone you know may be affected by these conversations, we encourage you to take care of your emotional well-being and step away if needed. For immediate support, please reach out to a mental health professional or contact the Suicide and Crisis Lifeline by dialing 988. We would like to extend a very special thank you to our sponsor, the Delaware Health Equity Coalition, for supporting this very important discussion. Joining us today, we have an incredible panel of women dedicated to mental health awareness and advocacy. Here with me today on the couch, we have Rebecca Roebke, Renata Lights, Chelsea Stanley, and Reverend Dr. A. Shellerine. Welcome, ladies.
Thank you. Thank you.
Welcome. Thank you so much for joining us.
Absolutely.
Yeah. If you wouldn't mind, just go around and tell everybody what you do and actually why you got into it.
Guess I'm first.
Yeah.
All right. I am a licensed clinical social worker with the Center for Child Development. So I am a therapist, basically, and we focus I focus on trauma and working with children, adults, and teens with trauma.
Okay.
Okay. Hi. So my name is Chelsea Stanley. I am actually the current Miss Delaware for America Strong. My platform is called Define Yourself, which is basically advocating for youth mental health because of my own struggles with suicide, depression, self-loneliness, and things of that nature. I want people, children, as well as adults to understand that you don't let society define who you are, you define yourself.
Yeah.
My name is Renata Lights. I'm the founder of TAG, Truly a Gem. It's a nonprofit for girls age 11 to 15, teaches them about mental health, self-care, self-confidence. I also am the college co-chair for First Aid Youth Move, which advocates for mental health for youth. And my job is to implement programs into colleges. I'm very passionate about mental health just because of my own struggles and what I've been through. So I really want to be able to teach everyone, especially youth, how important your mental health is.
All right. I'm Reverend Dr. Shellerine Addison. I am an Army chaplain. I've been a hospice chaplain for 17 years. With the Army, we do a lot of talk around mental health. I'm also the Faith and Trauma Mental Health chairperson for IMAC, which is the Interdenominational Ministers Action Council. And so I do a lot of work around faith and mental health.
Nice. So we have a wealth of knowledge here on the couch, right? Not just professionally, but some personal experiences. At the top, I mentioned that September is National Suicide Awareness Month. Why do you think this topic is so important? Why are we having this discussion?
I would say COVID opened up the window and the door for the truth. It didn't uncover what wasn't already there. It just exposed it on a higher level, and people couldn't hide it anymore. And now it has to be spoken about. And we have too many, one suicide is too many. Yeah. And so the fact that we can actually feel safe enough, so that is the challenge, creating a safe space for people to say, I'm not okay.
Mm-hmm. Absolutely. COVID definitely was an eye-opener for everyone, not just financially, but also emotionally. Being confined in a space, in my case, I had to work from home for practically 3 years because of COVID. Being confined in that space, it can drive you crazy a little bit. And when you have no social interaction, it can get very lonely sometimes. And so now that I'm glad that we have this conversation surrounding mental health so that we can get to the forefront of this. But as far as suicide prevention, kids and teenagers, it almost feels like they don't know how to handle it. And so I'm glad that we're having this conversation so we can get to the root of the cause.
I agree. And Rebecca, I'm sure you've seen, right, the difference from pre-COVID to, life after COVID.
Yes, the amount of people seeking out mental health services now since COVID has, I want to say, doubled, tripled, quadrupled, maybe, wait lists that we've never seen before. And so definitely, I think people are reaching out a little bit more, which is good to see. Yeah. But I think with stigma, that's always been an issue around why people don't seek out mental health services. I have experienced back in the 5th grade, and I'm old now, my friends of mine that I had that were, having issues with suicidal ideology at that time. And so it's always been there. And you're right, it has been. But I'm hoping we're making kind of strides to be able to have these conversations and to end some of the stigmas, but we still have a lot of work to do.
Yeah, absolutely. I agree with you. Let me just put some things into context, some stats for you. I think that's important to put some numbers around some of this. 800,000 people die by suicide each year. 800,000. Of that, 30% are women.
That's a lot.
Right?
Yeah, that is a lot.
Suicide is the 12th leading cause of death for women overall. 12th. And what's really scary is that young women, age 15 to 24, it is the second leading cause of death for them.
Yeah, that's pretty significant.
Yes.
You think about body shaming, you think about bullying, you think about trying to live up to the standard of what woman is, right? And then think about it from a faith perspective. We say Proverbs 31 is the ideal woman. Who can live up to that, right? And so you set us up for failure when you have these expectations we just can't meet.
Yeah, and we're going to talk a lot more about social media and cyberbullying because that's probably a huge piece of why this particular age group is being impacted. We touched a little bit on stigma. How can we as a society help break down some of those walls and make it comfortable so that people feel okay seeking treatment or seeking care or coming to see you? How do we do that?
I think by people being comfortable sharing their own stories, it'll let other people know that they're not alone. I feel like a lot of times people don't share their stories because they're scared that they'll be looked at differently. But if they see that someone else may have went through something similar, it could really help.
Yeah. But do you think that social media has given a space for that, for people to talk a little bit more openly about their struggles?
I feel like you have to find it. I'm sorry, I didn't mean to.
No, go ahead.
You have to find it. Because like you were saying about this whole standard of beauty, social media has amplified that into, especially women, thinking that we should be this when we should really just be ourselves. But as far as mental health, you really have to go and find those Instagram pages. So like for myself, in helping me with my own mental health, I literally got rid of anything that made me feel bad about myself and started looking for some more positivity so that it shows up on my thread and that it doesn't ruin my day.
Yeah.
Yeah.
Yes, that's part of that algorithm, right?
Yeah.
You start searching for things more on the
right.
positive. Hopefully you'll start to get flooded with things more on the positive.
Yeah.
I think it's ingrained in specifically little girls. What happens in this house stays in this house. Don't be a tattletale. Don't tell. And so if girls aren't given that safe space to say, so-and-so touched me, or I feel uncomfortable, they'll grow up to be women who just suck it up and drive on. And they'll never say they're not okay.
Is that a cultural thing? Or is that across?
I would say it's cultural.
Yeah.
I mean, I guess I would say for us it's cultural because, you got mommy saying, don't be a tattletale, all this other kind of stuff. Don't talk about it. Don't do this. Don't do that.
Just suck it up and just move on.
You know what they say about Black women? We're going to make it work.
Yeah.
But dying on the inside.
Yeah, so there's definitely a cultural piece there. Let's talk about culture, but in a different context. So you're a clinician. I'm a clinician. How do we as clinicians provide culturally competent care? How do we do it? Well, first, what does it mean, right? Because not everyone understands what that is. And then how do we provide that type of care? What does that look like?
I mean, I think for me specifically, I try to do a lot of learning about how to provide culturally competent care, because there obviously is, the differences that we look like when we kind of step into a room. And I think that not acknowledging the differences is the first mistake, right? That, that I do look different than you and you look different than me. And so our experiences can be different. So I think that that's the first step always, is to acknowledge that and to make sure, specifically, at least with my clients, that they're comfortable with that and that that's an okay thing. I mean, I know we have a lot of clients that do seek out, people who look like them for therapy, and that is okay as well, because I think we need to be comfortable, especially when you're seeing a therapist, with the person that you're working with. You have to be able to build a relationship. You have to be able to build trust. So I think that that's really important. But also, if there are things that I don't understand or I don't know, I try to learn. Because they aren't my learned experiences. And I think recognizing that they're not my learned experiences is important.
Yeah, I think that's number one, right? You have to, one, recognize your limitations, your biases, and then how do you evolve from there? I know in my practice, we have a diverse pool of clinicians. So at the front desk, you have African Americans, you have Latinos, and so people feel somewhat connected when they walk in. I don't go to work in sneakers just on accident. I choose to dress like this because depending on who I'm going to be seeing that day, I know this can make a good first impression on some people. Yeah. And truth of the matter is, my target are the youngsters, right? The 15 to 24. And if I look a little bit like them, or I can assimilate, or they can say, oh, okay, she might get me. That's an opening, and that's where we want to start. And then obviously clinically, you need to be competent. But I think a lot of it is just kind of recognizing that the differences exist, and it is okay to have those differences, right?
I think when it comes to women in particular, if you look at the trajectory of how education and how mental health has been put in place, you look at historically, menstrual cramps, different things has been demonized about women. And so taking it out of the box of westernized white male statistics and making it culturally competent to women in our experience has to be the starting point. We can't use what happened 50 years ago for a girl who's struggling with her sexual identity.
Absolutely.
We have to create something. We don't change the message, but we have to change the method.
Right, tailor it, right?
Yeah.
Yeah, that matters. And back to culturally competent care, making sure things are written in different languages.
Yes.
Right? If your population speaks mostly Spanish, you need to have some material that is written in Spanish. That in and of itself says that is a welcoming environment, and they get me, and let's at least give it a try.
With some Spanish people on the cover.
Right. That matters. Right?
Representation.
It really does. And for us to act as if it doesn't, that's unfortunate. Let's talk a little bit about racial trauma, and you kind of touched on it slightly, but racial trauma in the healthcare system. How does that impact us as women and deter us as African-American women specifically from seeking care?
Everybody's suspect, right? Because you think about it, right? You say, if you go to the doctor, you say, this is what I'm feeling. They tell you, oh, no, it's all right, go home.
How often does that happen? All the time.
All the time, right? So I think about being in the Army, okay? So I'm in the Army, and the standard is white women. So with hair, with grooming, with uniforms. And so when you got a big hip sister, she can't fit in them pants.
Right.
If you got curly hair, it's not going to slick back.
Right.
So you can't do PT in the morning because now it's going to be puffed out. Like there's certain things we just can't do. And so just having the ability to say, this is what I'm experiencing. Can you find somebody who knows what I'm going through? And then maybe I'll come back.
Yeah. And Rebecca touched on that, right? She said people want people that look like them.
Yeah.
Yeah. It's no accident that I get a lot of African-American males and females on my caseload. That's not by accident.
That's not by accident.
And guess what? I'm here for it.
Yeah.
Because it matters for them to see someone across the table that looks like them.
Right.
That talks like them.
Right.
I mean, I learned my slang from my 11-year-old, so I got to try to stay up on it, but it matters.
So I even think about, I've been a hospice chaplain for 17 years. And so just the way people grieve and the way people respond to death and dying is also different for women and men. It's also different for Black women and white women. I've noticed that white women are trying to be very, calm and don't cry, and Black women will flip out. But the clinical staff will be like, that's crazy. And I'll just say to them, listen, that's just the way she expressed. Give her a minute. Back up, though. Back up. But give her some space.
Yes, absolutely. Ladies, do you have any experience with seeking services in an office or practice or hospital that wasn't culturally sensitive or competent or didn't even try, right? Because sometimes people try and just mess it up, but didn't even try.
Yeah. Me personally, I have not, thankfully, but I've definitely seen it happen. And ironically, I've been binge watching the show The Resident on Netflix. And I recently watched this episode where there was this Black mother who had just given birth.
I know.
And she was neglected by the white nurse and the white doctor, but it wasn't until the Indian intern who was been paying attention the whole time and finally got her the level of attention that she should have gotten from the very beginning, but unfortunately it was too late and she passed away. Too often I just hear these stories and it even makes me scared. And so to kind of lighten the mood a little bit, I told my boyfriend, like, hey, if anything is wrong with me, I told my mothers, if anything is wrong with me, after I give birth, whenever Lord sends me any children, go get somebody, tear the walls down. I don't care what you got to do. Just go out there, get somebody, because what I'm feeling, other people are not feeling. So it gives me at least that sense of comfort. To know that there are other people that are advocating for me, even if I can't do it for myself.
That brings us to a good point. How do we, as not clinicians, but family members, and I want you guys to give advice to everybody watching and listening, how are family members supposed to identify if their loved one is suffering in silence or is having thoughts of suicide? Like, what behavioral, verbal, physical, what do they look for? Because unlike a stroke, right, where you might see some paralysis, a cane, you can say, oh, he looks like he had a stroke. You can't necessarily see the thoughts of suicide or even depression in some cases, because as women, we wear our stress well.
We do.
Right? We put on a facade, right? And so how are people supposed to identify that? Like, what do they look for?
I do think a common misconception is if somebody says that they're going to do something, that means they're not. That we don't have to take it seriously because if they said it, then it's okay. So I think no matter what, we have to always take that seriously. But I do think that there are certain, especially because I work with kids and teens as well, and a lot of times we get referrals because we're also in schools, and that's part of how we're trying to work with breaking stigmas, right? Like, you can go to the nurse if you have a headache, but you also can go to your therapist down the hall if you need to. But I think, there are times where the quiet kids get not referred, right? The ones that are throwing chairs or having outbursts or running out of the schools, they get referred quickly. But we're missing the quiet people who aren't necessarily speaking out. So I think we do have to be mindful of checking in and any changes in behavior that are going on, any isolation or kids who decide they're not going to do things that they used to enjoy and love to do. Just any differences that we're sort of seeing and creating a culture of being able to talk without judgment, especially to our kids, that I'm here to listen to you and I'm not always in fix-it mode, because that can be pretty frustrating, I think, for teens. My mom just wants to fix it all the time, and I don't feel heard. I don't feel listened to. So really being able to just listen and say, I'm here and I can hold whatever it is that you need to share with me.
Ladies, can you chime in? Because you said earlier that you've had your own personal experience with, mental health. What were some cues that you may have put out there that people just didn't pick up, that you wish they had sooner?
I definitely agree with her about maybe not being as excited to do things you used to be excited for. That's a big one. Like, for me, I used to really love doing this one activity, but I'm like, I'm not interested anymore. And your family should be able to see that and notice that and ask you about it. Also, another thing.
In your case, did they pick up on it? Or did you have to ring the alarm, so to speak?
It took a lot more. For them to actually notice. But another thing is sleeping. For me, I never nap. So when I was going through like a stage of depression, I was sleeping like all the time. That is something they definitely noticed. Those are two signs for me that
Were
are
you
really...
saying anything? Did you verbally, did you give any hints of this is, what I'm thinking?
Yes, eventually, but not at first.
Not at first. Yeah, Chelsea, you?
The same, not at first.
Yeah.
So throughout my teenage years, everything just kind of bottled up, especially in high school. But for me, it was definitely aggression. I had a lot of built up aggression, but I would never exert it until I got home. So I was quiet at school, but I was more so loud at home.
You took it out on the people closest to you?
Yeah, I did, because one, I didn't feel heard too. But at the same time, I wasn't expressing how I felt because I didn't feel like I was comfortable in that space. And it goes back to sort of like the cultural thing. Me and my mom, we've had a conversation since about this. But at the time, it was very, very difficult to talk to my parents about what was going on with me mentally. So I would just have these outbursts, and I would sleep a lot. But the one activity that really got a lot of my aggression out was soccer. So that was my outlet. But anything else outside of that, it just got bottled up until it was almost too late.
Yeah. So you work with veterans.
I do.
Yeah. Are there different behaviors or cues for the veteran population, female veteran population, that families should look for?
It's harder to talk about female veterans because they're acculturated socially to suck it up and drive on. And then they're acculturated by the Army, by the Navy, by the Air Force, by the Marines to just do what you're told to do. Yeah. So there's no space for emotion. There's no space for I'm not okay. So for me as a chaplain, I look for what they're not saying. Yeah. I listen for the silence of, if I say to them, are you okay? And they say,
the long pause.
Right? And particularly with women, I deal with a lot of women who are high-powered women, bishops, pastors, and they have mastered the art of looking like they're okay. Yeah. And so I will just ask the question, check in. I know I heard you say that, but let's talk about this. So I do a lot of open-ended questions to pull it out, right? Because for me, when you know better, you do better. Yeah. And as a woman who's mastered the art of being okay, I know what it looks like when you're pretending to be okay and you're dying on the inside. Right. Yeah. So for veteran women in particular, they've got a whole host of things that they have to contend with, kids, and same thing as civilian women. But as a service member, you're expected to drop everything and serve country and not think about all that other stuff. Mm. And so the signs are similar, it's just more contained when you have a service member because they've been crafted to be the machine to go overseas to do what they have to do.
Yeah, and Rebecca, you touched on this a little bit. You said, just the ask of, hey, are you feeling like you want to hurt yourself? Are you feeling suicidal? Guys, just so you know, that question alone does not elicit or make someone want to commit suicide. Mm-hmm. That question alone does not do it. What can do it is the lack thereof or not engaging in the conversation. So just asking does not necessarily plant a seed to someone who is not already suicidal, all right? And so I know it's fearful, it can be anxiety-ridden to just start the conversation. Yeah. And for Black women, Caucasian women as well, if you're not comfortable in that space, it's hard to say those words to, let's say, your kid. Yeah. Hey, are you thinking about harming yourself? Have you harmed yourself? That's hard to do. Right. And they're fearful that they're going to plant the seed, but it doesn't do that.
In our current society, you have to ask, are you going to harm yourself or somebody else?
Yes.
Right? You have to do the other part because maybe they don't want to kill themselves, but they're going to go to a school and shoot. You know what I mean? Yeah. So we have to take it a step further.
Yeah. And you want to know about their peer group too, right? Because when my teens, I say, do your friends self-harm? Because that matters. Who are you hanging with?
Right.
Because that matters.
And 9 times out of 10, they'll know before the parents will know.
Yep.
Yeah.
Mm-hmm. I think there's sometimes, for lack of a better word, it's glamorized, right? Like, and I think that's another piece of social media that we have to be careful of. I have TikTok because I try to stay connected to teens that I work with as well and know what's going on. But, there's a lot of people sharing their children's suicide stories and children who have completed suicide on that social media. And I wonder sometimes how I feel about that, but there's, a lot of rock stars in the recent couple of years that have
Yeah.
completed suicide. So I think it's hard because I think they try to turn it into something that is about education, but also kids see that and it's like, well, if they're doing it, you know.
Social clout.
Right.
We talked about that
Yeah.
in our office as well, where I don't want to say it's a trend, so please, I don't want you to misunderstand me, but there is a small population, there's a small thread weaved in there when it's trying to be good and intentional, where someone will interpret the wrong way and say, oh, I'm going to one-up them,
Yeah.
or this is what we're doing now, and let me join in. And so it's unfortunate. So
I think our young people have way too much autonomy and way too much access. I remember even growing up, like nothing belonged to me. Everything my parents owned. Those are my clothes. You have no privacy. And I would take the door off. Right? So when I raise my kids, everything you own belongs to me. That's my stuff. When you get your own house and your own car, and your own money, you do what you want. But now kids have space, and I need space. I wish my grandkids would tell me, Grammy, I need some space. What space? You a chassis, but that's me.
different generation.
Then it goes to take a walk.
It's different generation.
Yeah, it's
I
too
can
much
understand
access, too much autonomy, and you know we don't give them the safe space. You know, just like when kids learn to walk, you put the boundaries around them. They think they're doing it, and I think sometimes we just need to do that for some teenagers. That you think you're doing it by yourself, but I've already placed the boundaries around you.
Yeah. So, ladies, we're gonna take a break in a little bit, but I want to leave everyone with some more stats again to put this in context. Women are 2 times more likely than men to attempt suicide.
That's true.
Even though more men die from suicide attempts, women attempt it twice as much.
Right.
And some of that is because of the means and the method used.
Yeah.
Men have a history and a tendency to be a little bit more impulsive, aggressive, and their means are usually involving a firearm, jumping off of something, a bridge or a building, in front of a car. Whereas women, even though they attempt it twice as likely than men, twice as more than men, women choose different options like overdose, pills, right? Where there is still a chance to intervene.
Yeah.
Right? And so even though men die from suicide more, women attempt it twice as much.
Yeah.
That's huge.
The struggle is real.
It is very real.
The struggle is real.
And so that's why we're having this conversation. And I hope and pray that September, it doesn't stop here.
Yeah.
Like, I know this is the month, and it's a nice reminder to engage in the conversation, but it should not stop here.
I agree.
All right. But with that being said, we're going to take a break, and I hope you guys are enjoying the discussion so far. We will be right back after this quick break.
If you're a woman that needs help and needs some wraparound services, we at the Delaware Health Equity Coalition, Dr. Sydney Teal, Dr. Valma Scantleberry, and myself, we'd be more than happy to see you. We are located right in 19802 on Boehner Boulevard. See you soon.
Looking for a reliable and efficient way to travel around Delaware? DART has a variety of routes and schedules to meet your needs, providing service in Newcastle, Kent, and Sussex counties. Whether you are commuting to work or exploring the sights and sounds of the state, our fleet of buses are well maintained, equipped with modern amenities. Public transportation is the greener alternative. Plan your trip today. Download our transit apps or visit dartfirststate.com.
Welcome back to our discussion. So ladies, we covered a lot of topics in the first half. And so this time around, I want to get a little bit more personal, right? Because I'm sure not just us on this couch, but these guys out here and you guys out there, we have a personal story in some way, some capacity. And so if you would allow us, because I think that's huge, you talked about people opening up. And here's the platform, right? Because what you say today could save someone's life, whether it's inspiring a mom or a dad to have the conversation or the person themselves who is struggling with depression. And so no particular order, but if you wouldn't mind, just, letting us in a little bit more, sharing your personal story with us a little bit more. You know, why did you get involved with the organizations that you're involved with? Because it usually comes from place, right?
Yeah.
Close to home.
Well, I can tell you why I became a chaplain.
Okay.
In 1999, November 11th, 1999, I had a baby at 39 weeks that was born stillborn. And so he died a week before he was supposed to be born. And the chaplain that I had, she didn't know what to say. And I couldn't understand why a professional didn't know what to say. And my family was, you know, they didn't want to talk about it. And I wanted to talk about it. Yeah. And so just that notion of not feeling heard, not having the safe space to say, this really sucks, right? Because we try to use these flowery words. We try to make sense out of what doesn't make sense. And sometimes for people who are struggling with suicide, we try to give them words, and words sometimes just don't work. You know, it's presence. You know, we talk about as a chaplain, the ministry of presence. And you can't say to a person words that didn't help them prior to attempting to kill themselves, right? There has to be something. And so when I think about that, I think about, I had a soldier, we were supposed to come home from Kuwait. And a week before they were supposed to come back to us, he shot himself. Because he was so broken, because he didn't feel safe enough, because he didn't have somebody to talk to. He had a plethora of people, but didn't feel safe. And so I got into this to create the safe space for people to say, I'm not okay. I'm just not okay.
Yeah. Thank you.
So I got into pageantry 3 years ago. It wasn't something that I initially wanted to get into, but I watched, of course, the Miss USA pageant when I was younger, and I just thought, oh, that would be something I could do. But as a kid and a teenager, I dealt with a lot of body imaging issues. I did not feel confident within myself, and I was very shy and lonely at times. And so this go around, this is my second time winning this title, I said to myself, I'm going to do it right this time. So I created my platform, Define Yourself, for this particular reason, because I understand what it's like to deal with mental health issues at a very young age. And I didn't even know what they were at the time. I didn't know about depression, what that felt like, what having suicidal thoughts felt like, the isolation, everything, until it just reached a breaking point for me. And I was 17 years old when I was like thinking to myself, I'm gonna just take my own life. I don't feel like I should be on this earth. I don't feel heard. I feel like I don't have anybody that I can talk to, and that people wouldn't even miss me. It wasn't until I told my mom that I thought about this. And she was the one that took me to church the following Sunday. That's big in our family, going to church, because the head of the house is always God. And that's where we've always turned to when it comes to certain issues like this. But we didn't have a conversation as to what exactly was going on with me until I was in my 20s. And I just go through all of these different emotions over the years. And then 2 years ago, I suffered my first full-fledged anxiety attack and panic attack, 2 years out of COVID. And not really realizing what was going on with me and why it triggered it, because it's not the first time I've experienced anxiety, but that was the first time I experienced it at that level. For 3 whole weeks, I've been just anxious and on edge and everything. And then eventually I had a panic attack. That was the first time I experienced it. I felt like I was dying, just shaking in my dad's arms until the paramedics got there at 3 o'clock in the morning. And I was scared. I thought I was gonna have a seizure. I thought I was gonna see daylight. But eventually, again, going back to God and thanking my support system, my mother, my father, my other family members, even my friends, for just hanging on with me so that they understand, like, hey, this is what I'm going through and everything like that. And even being put on medication, this is another thing that a lot of people don't realize, that medication is not always a bad thing. I just take it on a daily basis just to control how I feel throughout the day. And I'm on a low dose, so it doesn't really affect me, but that's only part of the job. That's only part of the work that you have to do. Medication only helps you, but you have to do some work on your own. So I've been in therapy for the past 3 years, just working on myself and everything like that. And I can honestly say I'm in the best position that I've ever been in by going through this whole process. But it's always going to be a marathon. It's not a sprint. You still go through those emotions, feeling like, oh, I'm not good enough, or I have bits of anxiety and that my life is just going to be over. But I do certain techniques, like my breathing techniques, and just take a minute and step back and know when I need to step back whenever I'm starting to feel overwhelmed. So it's just a huge relief off me knowing that this is what's going on with me and this is how I take care of it. Thank you.
I would say for myself, how I got into like wanting to help young girls with mental health. Depression started for me like really young. I remember being like 12 and just feeling sad all the time and not knowing why. Kind of just feeling like left out of everywhere. I remember starting at like 12, I would constantly tell my mom, like, and I just don't want to be here. And she would be like, what do you mean? And I'm like, you don't want to be in the house? I'm like, no, like, I don't want to be here. And I went through that for a while. Eventually, it would get better. And then I feel like it got worse when I got pregnant. I don't remember what year it was. My daughter's 2, so.
22.
Yeah. I was really struggling with depression, and I was like, I'm just not going to be here anymore. But I checked myself in to Wilmington Hospital because I was like, I have to save my child. Like, I can't. So that was really an eye-opener. Staying there really helped me, like, see, like, I deserve to be here, and so does my child.
Yeah.
So I did that for a while. I really want to be able to help girls so that they don't have to go through the same stuff. I feel like it took me, if I would have gotten help that I needed when I was like a child the first time, it probably would have not got to that point.
Yeah.
Yeah. That's
So, but it definitely does get better over time. Once I met my husband, it helped a lot. Once I went to, it helps a lot. So just to keep going,
Right.
is really important. Just reminding yourself that you do have a purpose, and not forgetting what your purpose is. So my goal is just to be able to help young girls see their purpose.
Yeah. Thank you so much for sharing.
Yeah.
Thank you. And I know we have some audience members, and, you know, not that I'm going to ask you guys to necessarily share your story, but, you know, just think about how sharing your story can help someone, and how you look at Miss Delaware, right? And you're like, right? That's why I said you can't see it.
Can't see it.
It's buried so deep. So how do we as women manage some of the competing priorities, the stressors, the work, the kids, the husbands, the partners, right? Because society says we have to excel in all those areas, right? We have to do it and give it 100%. And that's in every area. Like, how do we juggle that and still protect our mental well-being? Like, what do you tell your clients?
Self-care, for sure. I mean, you know, I think there are a lot of things, but I think taking care of ourselves is number one. And also recognizing, because I do think that I'm a mom, and I think that there's something called mom guilt that's big. And I feel like I love my husband dearly, but I don't feel like he gets that same guilt when he leaves the children that I do, even to do something like go, have education or learning experiences, right? I still feel bad, or to go and get my nails done or my hair done. Like, I feel bad about doing that. And so I think over helping clients, that's really also helped me, right? To be able to tell clients, like, you can't do those things well if you're not taking care of yourself, right? Like, I can't be the best mom, the best therapist, the best friend, the best partner, anything if I'm not taking care of myself. And so I really feel like it does help when I have to teach that to others, to be like, wait a minute, I need to do this to myself, and I need to be mindful of this as well. So
yeah, and I tell my patients sometimes, I like to use things that they can relate to. And so I think I was talking to a mom today, and I said, if you've ever been on a plane and the stewardess is doing their thing in the beginning, and they tell you, hey, if you have a child with you, when the oxygen mask drops down, put it on yourself first, because you cannot take care of this little one. Right. If you're not good, a mom with no oxygen is no good. That's right. To a kid or to someone else that needs help. And so, yeah, that's a great point. You got to take care of yourself. But how do you do that? Like, how do you say no? How do you set limits?
You have to learn the art of saying no. As little girls, we're not taught to say no. We are taught to self-sacrifice. We're taught to sacrifice our voice, our vision, everything for our children, our husbands. And so we're not taught that we matter. And so therein lies the challenge. We're not taught that I matter. Yeah. We're not taught that if I can't breathe, I can't help you breathe. Right. And so we have to learn the art of saying no in increments, right? Because we're not taught to say no. So no is a whole sentence, I like that, but you have to learn, right, in increments. Like, you might be like, I'm not doing that. And then you do it. And then you do it. Not. Mm-hmm. And then you get to a point where you're like, no, I can't. I'm not. I won't, right? You got to get to a point where you matter, where you understand that I can't be all things to all people. I'm not a superwoman. I'm not in those things. But I will tell you, it takes time to get to that. Yeah. Because when you're young, you're taught just serve, just do, just do, just do. And so by the time you get 40, 50 years old, you're used to not breathing. Mm. You're used to
that's your new normal.
Right. So you get acculturated to dysfunction. Yeah. And you think it's fine.
Yeah. We share the oxygen.
We do, right?
We share, way too much of it.
We share the oxygen. So learning increments of saying no. And then you don't have to do self-care all at once. Take 5 minutes. And so here's what I tell women all the time. Listen, just take 5 minutes. Take 5 minutes, close your eyes, count to 10 backwards. Count to 10 backwards. And then when your body takes a big exhale, start over, right? Because if you close your eyes, you count to 10 backwards, your body's going to breathe. But then when it needs extra air, you're going to do a big sigh. So every time your body sighs, start back at 10. Mm-hmm. Yeah. 5 minutes will turn to 7 minutes, will turn to 9 minutes, turn to 10 minutes, turn to 20 minutes. And then you'll get to a point. So just like with medication, right? You got to titrate it. You can't just go once. So just titrate it up. 5 minutes.
People don't realize that it doesn't have to be.
It doesn't have
so
to
extensive. I work with a lot of mindfulness practices, especially. And I think a lot of times people hear that and they go, oh, meditation. And I'm like, nah, I don't have time to meditate. Exactly. I don't. Like, it would be lovely, but it doesn't happen.
There are some mindfulness practices that you could teach us and the audience and those out there, because we could all use some tips.
I really started with this over COVID. I literally make sure I sit with my coffee in the morning, right? I do drink a lot of coffee. So if you don't, it's okay. Tea, whatever you have. And just kind of like focus on that. I feel the warmth before I'm thinking about my 80 million emails or what I need to do that day or what's coming next or what activities the kids have this weekend or all the things that can sort of stress us out, right? So just thinking like how this feels, it's warm, and like taking a sip and just feeling that and just noticing. So if we can kind of ground ourselves more in the present, because I think as a society, especially, we're taught like we're the best if we can multitask, which none of us really actually can do very well anyway, because we're not really supposed to, right? Like, and especially women, like you have to multitask, right? And so really being able to say, no, it's okay for me to just kind of be in this moment that I'm in right now. And by putting our senses in that, even in the shower or the bath, like, let me just notice how the water feels as it hits me in the back or how my soap smells, rather than I have to think about what I'm going to do next. Right. And so just by doing these small 10 seconds of time every little bit throughout the day, you really start to create a much more grounded, less stressful experience for yourself, just, in little bits. And that really kind of came out, I think, a lot during COVID, where we couldn't do the big things that you normally would do for self-care. Right. So we had to find little teeny moments, right? And it's great because it doesn't require you to have any supplies. It doesn't require you to set up anything special. You have a pet, you can pet your pet and just kind of just notice, It's
funny you say that because I get up early in the morning. I get up about 4:20, 4:30. I go to a 5 a.m. gym class, a 45-minute HIIT class. I get home about 6. And from 6 to 6:30, that is like my time, right? No matter what I'm doing, I'm choosing to do whatever it is. And I get so upset when they wake up early. And now I know why. Because that's like your peace got disturbed. My peace got disturbed. I get so upset. Like first day of school, Maddie's up extra early. I'm like, oh. I'm like, why? Right? And so now I get it because that was my space. Yes. So I get it. And so it does make a difference. Carving out those little pieces of time. Let's talk a little bit about the workplace. Right? I'm talking sexual harassment. I'm talking women just trying to reach that glass ceiling. Right? Like, because that in and of itself can increase anxiety, depression. Right? Have you guys ever experienced any of that? Or do you have any words of wisdom for women that are dealing with that in the workplace?
Yeah, because you get a lot of microaggressions. And unfortunately, you might get more microaggressions from women than you do from men. Right? So I serve as the first woman chaplain in the history of the Delaware Army National Guard, right? Since 1775. So when you are a trailblazer, there's no template. There's no framework. You have to create it. And not only do you have to create it, you've got to lay a foundation for somebody to come behind you.
Right.
So you can't be the angry Black female. You can't be the, menstruating. Like you can't. So you have to like have 7 eyes going 7 places and you're hyper vigilant.
Yeah.
Because now you're like, I don't know who's on my side. I don't know who's with me.
Right.
And then you have this social construct that you have to walk and talk like a man in order to be accepted. Because I can say something, right? But I can say something and then he can say something and it's fine. But for me, I'm trying to be this and I'm trying to be that. So really being able to pause internally, to give yourself a safe space internally to adjust to what's happening around you. Because sometimes, all the time, you have to have an internal conversation in the moment to keep you from doing what you're not going to do.
Yeah.
So what you say to yourself leads to your emotions, which leads to your behavior. Yeah. So if you can pause in that moment and say, okay, I'm not going to cuss nobody today.
Please don't.
And that'll be your mantra for like 2 minutes. I'm not cussing today. And then that'll give you a minute to grab that emotion, then to change your behavior. And then you won't cuss.
Yeah.
But you have to practice that.
Guys, you listen, I'm not going to cuss today. Not today. Tomorrow's another story. We'll start all over, but not today.
Absolutely.
Yeah, that's self-talk, right?
Yeah.
So let me put some context because I love to do that because I think the numbers really do help bring it on home. Women who face the challenges like what we talked about, sexual harassment, are twice as likely to report feeling unwell and overwhelmed. Up to 38% of women report experiencing some sort of sexual harassment in the workplace, which we know is associated with mental health struggles, including PTSD, depression, and suicidal ideation.
It's still not safe. I mean, even though we got DEI, we have all these other things, for many women, it's not safe. You look at statistically with the veteran population, you look at women in active duty military, National Guard, Reserve, there's still a high rate of sexual assault, even though there's a big push and there's a big spotlight to say, we have a zero tolerance. However, if you're not correcting your brother and saying, don't say that, don't do that, it's always going to be there. And women are going to gather together and say, let me tell you what so-and-so did, but they don't feel safe enough to open their mouth and say, I'm being sexually harassed.
Yeah, there needs to be men to advocate.
Absolutely.
I agree.
Absolutely.
With you. Yeah.
Absolutely. Yeah. So if women don't feel safe, they're not going to say anything.
They're not going to say anything.
I think there's a culture around that as well that's hard because I think it also plays into legal systems and all sorts of things. When I work so much with trauma and a lot of that tends to be victims of sexual assault or, incest or rape or different things that happen. But one of the things that our nervous system does, and we don't get to choose, is sometimes go into freeze, right? Sometimes we talk about fight or flight, but we can also go into freeze and dissociation. And so just in that survival mode, we're trying to survive in the minute. We're not looking around for details and evidence and all sorts of things, but the legal system wants us to provide that. So by default, we're end up sort of saying, oh, that didn't happen because there's not enough evidence to support that it happened, right? Sad. And so then it kind of creates this culture of people not really coming forward because they don't feel protected. They don't feel like they're going to be heard. They don't feel like they're going to be supported because the legal system doesn't understand trauma.
And then you got the shame associated with, now you changed everything and you're the one who said something. It's been fine all this time. Now all of a sudden, now you want to say something.
You're the disruptor. It's a systematic issue.
What about domestic violence? What do we think about that? And depression, anxiety, suicide, ideation.
We're quick to tell people to leave without realizing that it might be safer to stay for a little while. We have to look at the whole picture of, we have this misappropriation of love, like we have misappropriation of funds. And so while it's clear that we have a clear definition of what love is and what love is not, in 1 Corinthians 13, stalking is not love.
No.
If you never have my every movement, that's not love.
That's love. Isn't that love bombing? Isn't that what that's?
That's not. So we have this misalignment of what it looks like and what it's supposed to feel like. And so you have a lot of young women and older women who just suffered in silence. They just suffered through it.
Like with sexual harassment, domestic violence puts them at higher risk for suicide ideation. Absolutely. I don't want to forget to make a clear distinction before, because we're going to obviously run out of time. As a clinician, talk about the difference between passive suicidal thoughts and active or imminent. Can you help distinguish between the two for the audience?
I mean, as best I can without my records in front of me. I feel like we're, assessing for suicide, I think, is a challenge as a clinician too, right? Because I recently, I supervise a lot of clinicians, and I recently had a clinician that lost a client to a suicide completion. And I think that's a really hard thing to go through, even as a clinician, because, I guess we're supposed to help with that. But I think in some ways there's nothing clear-cut that can always say that we can keep someone safe once they leave our office, ever. And so that can be very challenging. I think we do our best to assess, whether it's just ideation, am I just having thoughts, but I have certain ideas of why I would not complete a suicide or why I would not attempt a suicide. And then there are people that have a clear-cut plan. And so that would be a more active and higher level of risk because they have a plan. They say, if I were to do it, this is how I would do it. And then we're looking for resources, resiliency, what do they have, strengths, things that sort of can combat these issues or ideations, right? And protective factors, children, right, that they're having. And that's really important as well. So, we're kind of looking and assessing all of that, but I feel like at the end of the day, you can only do as thorough of assessment as you can do. I think that's something that I learned from a sibling. If they're going to attempt things, sometimes you can't stop it no matter how much you want to.
And speaking from experience, a person can only get help if they want help. You can't force it. Because in my past relationship, when I was going through some of the emotional issues that I was going through, he was pushing therapy on me, and I wasn't ready to go yet until 3 years ago when I actually started. And even in that in itself, it was like a trial and error. So that just added on more pressure. And now I'm seeing other people that I feel like need therapy, but I know that I can't push therapy onto them because that's the same thing that happened to me. If they want to do it, then they're going to do it.
So let me ask you, what do you wish your families would have done differently for you? Chelsea?
Create that safe space for me to actually express how I'm feeling. Yeah, they ask me every single day, oh, how was school? How was your day? And I know everybody will say oh, I'm fine, when really I wasn't.
How would mom or dad have done that? And if we got a mom out here who has a child, a son or what have you, and how would they create that safe space? Because there's no book, right? We don't know how to do this. And so how would you have preferred your family to create that safe space?
I would say one, it starts from an early age. So if they're able to have that safe space, even just making a simple statement like, hey, if there's anything that's going on with you, you can come to me, right? Just something as simple as that. It doesn't need to be a discussion because they may not want to talk about it initially.
Yeah.
But just saying just that simple statement like, hey, I'm here if you need me and everything like that, that at least opens a door.
Yeah. Renan, what could your family and your friends have done differently for you?
I think maybe just checking in more, because I feel like obviously it was known that I was going through depression, but it was kind of like, okay, she's going through it, like, but not like a consistent check-in. So maybe asking me more probably would have made a difference.
Yeah. Okay. Yeah, I know looking back, it's like, this is what you would have, probably benefited from. But again, there's no rule book. And so I think people are really just out there just trying to do the best they can.
I think it's also a family issue too. Like I wasn't the person that was depressed or expressing suicidal ideation, but I also feel like when you're not that person, checking in on those people too, right? Like, so the whole family as a system can get support as well, because it affects everybody in the family. When someone is struggling from something with their mental health, it affects everyone. And so, I think as a system, we all need to kind of have support in different ways. Because sometimes when you're the okay one too, like it's a really hard place to kind of sit as well. So I think it's important for everybody to get that support.
Yeah, that's difficult. Guys, we are about to jump into some Q&A with our live studio audience. Yay!
Fantastic job. Really enjoying the conversation. So I had a question. It stemmed from a part of the conversation you talked about being a mother, being a boss, being a this, being a that. And me personally, I'm an artist. And sometimes I wonder, okay, when I'm ready to have a kid, will I be able to balance it all? What will my mental state be like? Am I going to be a great mom? Can I still be a great artist? Can I still be a great friend? Like, do I need to take time off to just be a mom? But I see, people out there doing it all. But then, you still wonder, okay, what will my mental state be like in that time? And how do I manage it? How do I prepare myself mentally for, those changes that can happen?
Yeah. I would say everyone is different. You don't know. But I will say this, if prior to having children, you already struggle with mental illness, then you definitely want to make sure you have a good, solid plan in place, because that increases the likelihood that come postpartum, menopause, that will change, and that could potentially make that even bigger of a situation. If you have a family history of postpartum depression, again, that's something you want to kind of really pay attention to, because genetics are huge. People not only pass down looks, but they pass down those traits too. And a lot of times depression, anxiety, schizophrenia, that stuff lies dormant. It's like that pilot on the stove. And then those little things that happen around you in your environment, those social stressors, those kids, that husband, whatever, that bad relationship, and here we go. And so everyone is different. I can't tell you exactly how you will manage it. You will manage it though.
I think it's a lot about expectations, right? Like, I do feel, because, I work and have 2 kids, I feel like managing expectations that I have for myself is really important. And also intentionality, right? When I'm with my kids, I might not be with them for a long time out of the day because I'm working pretty late to fund their activities that they're doing. But when I am there, being sure that I am present, because regardless of the amount of time, being intentional and present the time that I have is what's going to be the most important with them. So I might not be able to have 7 hours of the day with them, but if I have a good quality 30 minutes of intentional time, I think they're okay. So I think it's definitely managing our expectations and our intention with our time. That's really important.
One thing I will say, as someone who also wants to be a mother in the future, just this one mantra: just take one day at a time. because one of the things that triggers my anxiety is the expectation of what's not going to happen, the unforeseeable future. How can we all of a sudden just predict and feel off of something that hasn't even happened yet? So just learning to take one day at a time, so that when it does come, whenever you do feel like, oh, this is too much, just learn to take a step back and just live in the moment and just know that tomorrow's another day.
Yeah, it's good advice.
I would say be kind to yourself.
Yes.
Yeah. Give yourself the grace and the space to feel how you need to feel and think what you need to think. And make sure you're not putting yourself in a position that you can't. I'll put it this way. Don't let your heart write a check that your mind can't cash. And sometimes as women, we are moved by, oh, he's so cute and biological clock. But mentally, you just can't do it. So always let your heart and your head have a conversation. And if they're not in agreement, don't do it. Wait until they're in agreement, because if your heart is writing the check, then your mind can follow through and say, you know what, I got you.
That's good advice. I like that. Yeah. Thank you. You're welcome. Thanks for your question. Any other questions? Yes.
What about that? Very good in sports, popular, but then when they come home, they cut on themselves, get up at night while everybody else is asleep, and go out the house because they want somebody to actually find them and kill them, do away with them. So now they're in therapy, but I believe they're actually fronting because all this is still going on in their mind. What do you say to that?
Yeah, that's a good question. That is a good question. Take that.
What would you say? Well, we go back to safety. It really, at the beginning of the day, the middle of the day, and the end of the day, goes back to safety. That there has to be a place of safe space somewhere in the midst of that. And so let's suppose that person came to you and said, this is what I'm doing. Number one, we're not clinicians and we can't. Sometimes we're trying to help in spaces and places that we're not equipped to do. And we do more harm than good. And so just like I tell soldiers that if that person says to you something like that, you are now tasked to be that person's battle buddy. Not to fix the problem, but to be the liaison and the conduit to get them to healing. And so if something is happening that intense, then that's a situation that you have to do what we call in the clinical world a soft handoff. And you have to get them to somebody who can immediately hit the ground running with what they need. Not all this flowery, like I believe God. Sometimes you need God in the couch, God in the pill, God in an inpatient unit. And so for me, I would say that is the place where you can be the conduit to get them to where they really need some help. And words sometimes get in the way. And if we don't know what to say, sometimes we just need to be quiet and get them to the people who know what to say.
Yeah. Thank you for your question. Any comments, question? Anyone want to maybe share their story?
Definitely first a comment just to say thank you for being so transparent, sharing your stories, and for what you're doing. I like the fact that you calling it a safe space, because I think we all need safe space, and not just to share, but also to learn. So I'm someone who haven't been impacted personally, but the fact that I'm learning to know what to look for, that's also a big deal. So in both sides, it's a really great thing. So thank you for that. My question was, I forgot your name, I'm sorry. Chelsea, you mentioned you had your mother, your father, you had a family there. Like what was what was that thing that made you feel like you were so alone, even though that you had what it sounded like a family who was caring for you and rooting for you?
Yeah, my family has always been a big support system ever since I was little. You know, when they say, it takes a village to raise a child, it's really true. So we've been there for everyone. It was just that pivotal time when I was a teenager, when I was going through bullying in school, and I was trying so hard to fit in. I changed myself into a person that I thought someone else would actually, because I was striving for that attention, because I was afraid of being alone. And so all of that just compounded. And then going back home, it was almost like I was hitting a double-edged sword, because my family wasn't listening to me. We didn't have the support in schools at that time. So there was no therapist, there was no counseling or anything of that nature to help me at least in school. So I didn't know where to turn. I thought about running away on top of committing suicide. So at that point, it was just very difficult for me to find where to turn to. And it's even more difficult when you felt like you couldn't turn to your parents. And because at the age that I was, I couldn't just go up to my aunt's house, even though that's where I wanted to go when I wanted to run away. But I just thought, like, what are my parents going to think? Yeah. I didn't want my parents asking questions. That was a definite thing, because I didn't want to talk about it because I felt like they wouldn't understand. But now that I'm older and they do have a more understanding of what was going on with me at the time, and so now they see that certain things upset me, like this, like whenever I'm in my mood and I'm trying to like focus on something, my mom knows to leave me alone, just let me be for a little bit, and I'll come back to you. So it does take time for families to see certain things, but it's really only up to the person to actually say something at that point.
Yeah. And I think, more and more there are more and more resources available. I know earlier today we were talking about apps and websites, and I want to make sure that I mention some of these, because if someone is out there and they're listening and they just don't know where to turn, right? You got the crisis hotline 988. You can always call 911. You can always go to the nearest emergency room, and they will always talk less and do more and get you where you need to be in an inpatient facility. You have, we talked about some local telehealth 24/7, right? A culturally competent resource. We talked about apps like Headspace, Calm. And there's, again, you can text the crisis lines as well. And NAMI, a great resource. Yes. NAMI, National Alliance on Mental Illness, a great resource, not just for the person that's suffering, but for their families and the people around them. You can often do Zooms and educational things and, print educational stuff and give it to your clients and their families or for yourself, right? So NAMI, guys, please don't forget about that. NAMI is a huge, huge resource. And workplaces now, they have the EAP program, right? The Employee Assistance Program. Don't forget to utilize those resources, because those resources can make all the world of difference.
And if you're military connected, military active veteran, you have this called Military One Source. Military One Source. And also, that gives you a lot of information.
And also a lot of employer insurances now cover therapy now.
Yeah. So I want to thank you guys from the bottom of my heart for sitting in on what is a pretty difficult topic to discuss. But I like to think that we did it right. We did it with some justice, right? We added some nice amount of context to the conversation. But I implore each one of you not to let the conversation stop here. Just because September is identified as the month to discuss suicide, don't let it stop here. This should be the beginning. And so just like the 5 of us have sat here and talked, now I want you guys to go out there. And I know people, they're on your radar. There's somebody that you're like, I probably need to reach out to them. Reach out to them, because you have this God-given intuition that's there for a reason. And when something's not right, it's telling you. And so you need to definitely listen to it. Because of COVID, things have changed and people are okay meeting each other and talking and socializing via Zoom, right? And so if you have people who you can't see that live far away, meet them on Zoom every other Friday or something, right? Like, you have to find those times to connect with your family and your friends and your loved ones and those that are struggling. So I want to thank you all so much for taking your time to come up on this panel. And I want to, again, encourage everyone to continue this very crucial conversation, because it is huge, it is big, it can make a huge difference in someone's life. So again, thank you for joining us for this crucial episode of Every Woman, Suicide Prevention and Mental Health are topics that need more attention. And we hope that today's conversation will help break some of the silence for those that need it most. We'd also like to, again, extend a very special thank you to our sponsor, the Delaware Health Equity Coalition, for their incredible, incredible work in advancing health equity and making sure that mental health reaches all corners of our community. For more information and resources, visit DelawareHealthEquityCoalition.org. Thank you so much for your time, and thank you for watching.
Thank you.